When a couple struggles to conceive, the societal focus often falls on the woman. However, data indicates the male factor is involved in 50% of all infertility cases. To move from uncertainty to control, we will build a concrete, actionable fertility action plan. By the time we're finished, you'll have a specific checklist to take to your next appointment. This plan focuses on 3 deliverables: identifying hidden physical causes, demanding advanced laboratory tests that go beyond basic counts, and implementing a daily routine to protect your genetic health. By treating male reproductive health as a measurable engineering problem rather than a mystery, we can begin to address the actual obstacles to conception. Step 1 is auditing the root causes. This requires moving past the misconception that a normal sperm count is the final word on fertility. You can have millions of sperm, but if their internal code is damaged, the count doesn't matter. The most common physical roadblock is often invisible: a varicocele. These are swollen veins within the scrotum that effectively disrupt the cooling system of the testicles. This thermal diagram illustrates the mechanical failure. The swelling traps blood and raises localized temperature, creating an environment too hot for healthy sperm production. This heat generates oxidative stress, a chemical reaction acting as a corrosive, striking and fracturing the DNA strands inside the sperm. Everyday variables can accelerate this damage. Smoking, obesity, and chronic mental stress all increase the levels of reactive particles that contribute to this oxidative decay. Identifying these sources of stress, whether they are physical, like a varicocele, or lifestyle-driven, is the foundation of your recovery plan. Now, look at the doctor checklist on your plan. There are 3 advanced tests you need to request specifically, because a standard semen analysis will likely miss these details. First is progressive motility. It isn't enough for sperm to just be moving. They must swim in a straight line to reach the egg. If the cells are only swimming in circles or remain stationary, they cannot complete the journey. Without navigation, volume is irrelevant. Second is the DNA Fragmentation Index, or DFI. Think of a book with a perfect cover, but when you open it, every page is violently torn and unreadable. DFI measures the internal genetic damage that a standard microscope check can't see. If your DFI is over 30%, it becomes a primary driver of recurring miscarriages and failed IVF cycles. You need this specific data point to understand your success rate. Third is the fructose test. Fructose is the fuel produced by the seminal vesicles. It provides the literal energy sperm need to move. If fructose is absent, it signals a clear anatomical blockage in the reproductive tract, meaning the sperm are being created but have no way to exit. Requesting motility, DFI, and fructose tests moves you past basic observations and forces the medical system to diagnose actual mechanical failures. Now, let's fill in the right side of your plan, the daily routine. This protocol is specifically designed to neutralize oxidative stress throughout the day, starting with your morning. Dedicate 30 to 45 minutes to exercise to stabilize testosterone levels, and introduce specific antioxidant supplements like CoQ10, zinc, lycopene, and vitamins C and E to protect your cells. In the afternoon, shift your diet toward green vegetables and walnuts. Most importantly, keep laptops off your lap. Eliminating that direct heat source is a simple but vital way to prevent further DNA damage. Your evening protocol requires a strict 7 to 8 hours of sleep and a zero-tolerance policy for alcohol and smoking. These habits are direct contributors to DNA fragmentation. This protocol operates as a calculated daily biochemical defense system to protect sperm DNA from active damage. If lifestyle changes and supplements do not produce results after several months, your action plan pivots to medical intervention. For a physical varicocele, a microscopic varicocelectomy can tie off the swollen veins. This removes the heat source, allowing the body to naturally restore DNA quality over the following months. For persistent blockages or severe DNA damage, the plan moves to assisted reproductive technology. The ultimate technical solution is Isaxi, intracytoplasmic sperm injection. In this process, a single healthy sperm is selected and manually injected directly into the egg, bypassing every physical and motility-based obstacle. Even when dealing with severe fragmentation or anatomical blockages, modern medicine provides the mechanical tools to achieve a successful pregnancy. Review the completed plan you have built. You are no longer navigating this process with generalities. You know the threat of heat-induced damage, you have the specific tests to demand from your doctor, and you have a routine to stop oxidative stress today. Taking this checklist to an andrologist and beginning the morning protocol tomorrow is the most direct way to take control of your reproductive future. Book your consultation today. For more actionable, task-oriented health tutorials, make sure to subscribe to the channel.